Hi there, my name is Teresa and I'm going to be demonstrating how to do orthostatic blood pressure today. This is my patient Sally and I've introduced myself to her and I've checked her ID and I've asked her to please state her first and last name and her date of birth, and I have told her that I'm going to be doing orthostatic blood pressures, which entails me to have her to lie down and have a blood pressure and heart rate done, and then to be in a sitting position and have a heart rate and blood pressure done, and then to be in a standing position and have a heart rate and blood pressure done. The patient states that there is no issues or problems for her to be lying down, sitting, or standing for the heart rate and blood pressure demonstration. So I will turn and do my hand hygiene, and I will have the bed up to a workable level, and I will ask Sally to lay down on the bed in a comfortable position. I will always give the patient 5 minutes of a resting period to rest their heart rate and rest their blood pressure for 5 minutes. I will also ask the patient to not talk, not to cross her legs, and to hopefully not have exercised, eaten anything, or smoked 30 minutes prior to us doing the blood pressure and heart rate. Okay, it's now been 5 minutes. So Sally is laying flat. Her legs are not crossed, so I'm going to go ahead and perform a blood pressure on her first. Okay, I've gotten the blood pressure. Now I'm going to check her heart rate on the radial pulse for 1 full minute. Okay, I've got that. Now I'm going to want to document her blood pressure and her heart rate, and also document which arm I used and what position the patient is in, and if there are any signs and symptoms occurring while she's in the lying position. The next thing that I'm going to do is ask Sally to sit up. I'm going to assist her to sit up on the side of the bed. And I am going to perform a blood pressure and heart rate on her. And I'm going to ask her, do you feel dizzy or anything? You feel lightheaded? And she has stated no. So I'm going to proceed with going ahead and doing the blood pressure in the sitting position. Okay, and I'm also going to get a heart rate and the radial for 1 full minute. Okay, now I'm going to ask Sally if she's feeling faint or dizzy or anything right at the moment. If she was to be feeling faint or dizzy and the blood pressure had decreased and the heart rate increased, then I may wait a few minutes and recheck it again in the opposite arm. But since she has stated that she's not feeling any signs and symptoms, then I would go ahead and ask her, would she mind standing for me? So I would have her to stand. And I would have her in the standing, have her to stand, and I would go ahead and perform a blood pressure and check her heart rate in a standing position. And I would ask Sally, do you feel any dizziness, or do you feel faint, or do you have any symptoms? And she has stated no. So there again, even in the sitting and standing position, we would have documented the position the patient was in, the results of the blood pressure and heart rate, and which arm that we used, and any signs and symptoms that occurred, and if there was an abnormal blood pressure then and any abnormal signs and symptoms, then we would report that to the doctor right away. And we would put on the whether the patient was able to tolerate in the standing position, and if there were any interventions that I've had to do to prevent any type of unsafe moves with the patient. And that's it. Thank you.